Hey everybody, I'm Greg the RVCarnivore, and we're in for a treat today because with me today is Dr. Annette Bosworth, aka Dr. Boz. Thank you, Dr. Boz. This is awesome. So I was asked to be prepared with a list of questions. So let's see. I polled you to find out what you wanted me to ask her, and so here we go. If you don't mind, we're just gonna. All right, if you're as confused about your health as you probably are, that's probably accurate, isn't it? Well,
thank you. First of all, thank you for including me in the people that you talk about, because what you're doing is quite the megaphone, and I really appreciate the help of saying we need a lot more people talking about this and sharing their experiences. So,
well, you're welcome, and that's my endeavor is to promote you because I'm not a professional. You are. You have the nice white lab coat. I don't. I just wear blue shirts. So I can give you a long introduction about Dr. Bosworth, but what I'm going to do is I'm going to have Dr. Bosworth tell you where this all started for her.
Yeah. So, having a YouTube presence makes me really cool with my kids, but it was not on my top 100 things to do in life. Just the other day, somebody asked me, how did your first YouTube video come about? And it's because I'm an internist, an internal medicine physician that takes care of long, complicated problems. And when you have long, complicated problems, but the person paying the bill is either Medicare or Medicaid, they say, oh, doc, those are chronic problems, and we will let you bill for those once every 6 weeks. And after the 20-minute visit is up, once a year you can do a 40-minute, you can do a couple of crazy things to your charting and get a little more billing for the 40 minutes. But if you want me to get all of this done in a 20-minute visit, where their chronic problems were related to, well, their sleep, their eating, their environment, their stress level, and my prescription pills, although could improve things on the numbers, was not going to make them healthier. Without the baseline education that was going to be needed, I needed to educate. So I donated the second 20 minutes every all of these 40-minute visits saying, okay, I get the stage, this is what you need to do between now and next time. And as would be expected, most patients just couldn't absorb. They were in a place that wasn't comfortable. They were here because they wanted all these questions answered. And if we didn't get all the way through their list, and at which point I wanted to say, this is the agenda we have to do if you want to stop coming to see me so often. What I quickly learned was, hey, that improvement in their health was starting with education. So I made a video and I said, all right, this video has some blanks filled in it. I'll know if you watched it because you need to come back in with all these filled out. And it was on sleep, and it's like 2012, and I had a friend of mine record it, and in the end it turned out great. I still send people to it today. My name is Annette Bosworth, and I'm an internal medicine physician here to educate you on depression. I, along with other primary care physicians, have learned to embrace the spectrum of mental illness. I have been educating patients, colleagues, and medical students for years on the science behind mental illness and mood, and how that has evolved in our treatment plans and in the research behind what we've learned. But that was the beginning of how do you take medicine and really just transcend that one-on-one visit inside a clinic and improve the delivery of quality care that transforms people.
How long ago did that happen for you when you had that realization?
Oh, well, 2012 was when the video was recorded, but I was scratching around figuring out trying to find other ways to do it before that. But that was the first video, and then, chronic problems happened to the people I love the most. And 71 years old, 2 rounds of chemotherapy under her belt, 50 pounds overweight, doing everything I asked, the perfect patient, just didn't miss a beat. But when the person walking through the door was ashen and gray and lymph nodes the size of oranges in her neck, and we said, yep, chemotherapy is the option, she said, no, I'm not doing it. I've done everything you've asked. This isn't working. I'm not getting healthier. And the last time chemotherapy happened, She's a seamstress. I didn't know what a sewing machine was for 6 months. I'm not doing it again.
Wow.
Yeah, and she asked the question that is intimate, that if I'm being brave, I answer it honestly when patients ask, but if I'm in a hyperclinical mode trying to get through the day, I'll sometimes tell them what the textbook says. And the question is, if it was you, what would you do?
That's a pretty stout question.
Yeah. And there was a front door in front of us, and there was a hallway leading to chemotherapy. And I said I'd walk out that door and I'd do a ketogenic diet for the next 6 weeks and see what happens.
And how did that turn out?
Yeah, she didn't know what that word meant. It was the sloppiest version of a keto diet I've ever done. It was the first patient I ever walked through that. And we were hoping that her cancer predicted death by how quickly it doubled. It was doubling every 6 weeks, which is the time you need chemo. You got to do chemo. So 6 weeks later, no chemo. I was just hoping it rose by 50%. It just didn't double.
Mm-hmm.
I didn't have any room in my mind for a result that dropped her numbers by 70%. And the doctor ordered
70%.
70%, which is more than it was expected to do with chemo.
Wow.
Yeah.
And her relationship to you was?
Yes. The punchline there is, that was my mom. That was my mom.
And I think sadly that is a connection that you and I both have, because my mother passed away from cancer. And interestingly, I was in Texas where we had caught up once again at KetoCon 2023. And while I was there, a lady was parked next to me, and she came out and she asked me what this was about, the RV. Mm-hmm. And I explained it to her, and she said, my mother just passed away from diabetes, and I need to do something about my health, or I'm going to go the way of my mom. And it's kind of scary when it's your own family.
Oh, well, the pandemic that got everybody's attention and shut down the world really should be chronic diseases that are slowly nicking away the souls of, the way people die is slow and awful.
It's a slow motion car crash.
It is.
And we watch it happen, and we can't get out of our own cars to help. So that's going to lead me to a question that I'm going to ask you, because this is a question from my audience that asked me. So real quick, just to explain, I heard this morning on my drive over, I heard an interview where someone said, and I thought this was pretty prophetic, he said, we're not getting older, we're getting sicker. Mm-hmm. And the more I thought about that as I drove, the more I realized he was absolutely right. We are just getting sicker.
Right.
So I'm glad he said that. I think his name was Irby. Mm-hmm. I'll give him credit when I look back at it. The question is, at every campground I go to, the number one question is, but what about your cholesterol? So 1 minute is how much time you have to answer that question before you either suck them in and they're going to stay listening to you, or they're going to throw up a red light, because everything I do is green light, yellow light, red light.
Right.
Green light, they ask that question. Yellow light, they're now watching my answer. Red light, you either have them or you lose them. So you have green light, yellow light, red light.
Right.
What about your cholesterol?
So cholesterol is globs of fat circulating in your blood. That's what cholesterol is measuring. These globs of fat that are circulating in your blood, they've got water on the outside. That's what we are trying to understand when I check your cholesterol. But before I ever let somebody check a cholesterol, before I ever even think of those globs of fat, the first thing I think about is, what is their blood sugar level on average? Because it is how sticky those globs of fat are that have way more to do with their prediction of their health span than that lifespan. Everybody keeps, am I going to drop dead of a heart attack? Drop dead of a heart attack, that happens. It isn't those globs of fat that did it. It's how sticky they were. Start first with your average blood sugar.
So it's not your, I guess, how would I say this? Is this the equivalency of butter on the floor is slippery, Kool-Aid on the floor is sticky, same thing in your arteries?
Yeah. Well, the step that people think, how well do you need fat to live? That's what makes your brain healthy. I mean,
But we're told fat's killing us.
yeah. Well, I would like you to see which two parts of the brain or which two parts of the body are the fattest: the sex hormones and the thinking hormone. Okay, and they are the most vital areas for that person in life who's really doing life.
Okay.
If that sex drive, or if that energy for life is not being fueled, they really, you can see it from across the parking lot. And if their brain, I mean, that commodity of the brain not working well, if you can't be alive today and not have seen this in somebody where their brain is not working right.